So I'm Ben Shepherd and I'm an emergency medical technician for East Midlands Ambulance Service. There are a number of things that we want to do and we want to make sure of. So first off, let's remove any burning clothing. Unless it's sticking to the skin, I want that gone as soon as we can and the area exposed. Then we're going to want to cool the burn for a maximum of 20 minutes, and we want to use cool water. We don't want to use ice water or ice, because that will have an effect later on in the healing process. If we can get rid of any jewellery that they might be wearing or any tight bands, because there's going to be some swelling. And also if we can start to think about looking towards the face and the head. If there's any burning to the face, if there's any singeing to the hair, if there's any black soot around the mouth or the nose, if the child's coughing up anything black, or if there's a wheeze, well then we're going to want to deal with it. That is a 999 emergency, or get straight to A&E where they can deal with it. We don't want to use any ointments or creams. That's going to make it harder for us to assess as medics or for the doctors to assess later on. And as for dressing burns, after you've cooled it, then cling film is usually the best. Don't wrap it tightly, it just wants to be on loose to allow any swelling to take place. If you haven't got any cling film, then any bandaging that's not going to stick and is wet, it must be wet before you put it on. And as for when to get us involved, as I say, if we're worried about the airway, about the face, then that's a good start. Alternatively, you can take the child's hand, and if you imagine their hand and their fingers, their palm and the fingers, that is roughly about 1% of the body surface area. 10 hand places of burn, 10%, then that child needs to be in hospital. Otherwise, if you're concerned about the burn, then take the child to hospital yourself, or if that's not possible, 999, and we'll be happy to come and take a look.